ventricular system.
Okay, this is the heart, 3 different models of it, and we're looking at the anterior view of it, and the bottom of all 3 of this is known as the apex, and the top portion of all 3, and this one right here, this portion up here, this portion up here, this one is known as the base. There are 3 different layers. The epi or pericardium surrounds the whole heart, is the layer that surrounds the entire heart right here, here. It's kind of hard to tell on these. The myocardium, this one has a good myocardium, and the inside, so if we were looking, this would be the peri, the myo would be the thick layer, and the endocardium would be the thin layer kind of surrounding right there. Let me see if this one's not a good one, but yeah. So you can kind of see the outer layer, pericardium, myocardium, and endocardium, the inner layer. So the interventricular septum is this one that separates the ventricles right here. So interventricular septum, this heart, interventricular septum. So the vena cava, superior and inferior. I'll put this back. This is the superior vena cava, and the inferior one would come out right here. And on this one as well, superior vena cava, inferior one would come out here. And this one, superior vena cava, inferior one would come out here. So the pulmonary trunk. Put this on real quick. Okay. The pulmonary trunk is this little portion right here. It kind of branches from the posterior side, and it's kind of where the blood is taken to the lungs. It separates and goes to both lungs right here. So the pulmonary trunk, and the pulmonary veins are right here in this section on the left atrium. So pulmonary trunk where it branches to the lungs, pulmonary veins where it comes back. On this one, this would be the pulmonary trunk, this purple structure where you can see the branching off to the lungs, and the pulmonary veins are right here where they'll be coming back oxygenated, with oxygenated blood coming back to the heart. And here, this is the pulmonary trunk. It's branching off right here, and then the pulmonary veins right here. So the aorta is this big red thing, is super thick, and this model, the aorta is this big red thing, super thick. This model, the aorta is right here, super thick. So the coronary arteries and veins, so we say they were on the anterior side of it. Alright, so there will be left and right. The blue are the veins right here, and then the red, there will be like left and right, or left and right.
Would it be in right and left?
Right and left, and right and left. I think they're kind of going down the middle. Hello. Okay. So the coronary arteries would be the right and the left, right, coming off there, and then the coronary veins would be the right and the left. They kind of branch off on the anterior side. And on this one would be, is this one, the right and the left, and the right and the left coronary veins are blue, coronary arteries are red, right and left. Some of it's harder, I think, or is this? We'll ask her to clarify that. We're not really sure. It's kind of hard to depict. Is this the right one?
Yes, because it would be in the right.
Yeah, right this is right. But like, okay. So this would be the left. This would be the right. This would be the right. This would be the left. Okay. Got that. Here, right here, this little portion, coronary sinus. And the coronary sulcus is actually the space between the atria and the ventricles. So the coronary sinus fits into the coronary sulcus right here. So the coronary sinus is the space between the atria and the ventricles. Coronary sulcus, or coronary sulcus. So coronary sulcus is the space. Coronary sinus fits there. Same thing here. Coronary sinus fits in the coronary sulcus. Okay. Interventricular sulci.